On the morning of August 25th, Secretary Kennedy demanded two things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause.
Hello, I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond.
Dr. Susan Monterez, former director of the U.S. Centers for Disease Control and Prevention, tells a Senate committee that U.S. Health and Human Services Secretary Robert F. Kennedy Jr. required that all CDC and personnel decisions be cleared by political staff, not doctors, researchers, or scientists. So let's listen to more info about vaccines and the impact or lack thereof. Let's roll the next clip.
In May, Secretary Kennedy announced in a video on social media that the COVID vaccine was no longer going to be recommended under CDC guidelines for most children and pregnant women. The fallout was actually immediate. I heard from a nurse in my state who was pregnant. She was trying to get the vaccine. She was turned away by several pharmacies, ended up calling my office and saying, what am I going to do? Dr. Howery, I wanted to ask you, how did you learn about CDC's new COVID vaccination guidance in May?
The same as you on social media.
What was your title at CDC when that happened?
I was the chief medical officer of the agency.
It's unthinkable to me that the chief medical officer at CDC was left in the dark about such a consequential public health decision that affected real people. Dr. Howery, how was this change in guidance supported by scientific evidence?
We have not seen the data yet. In fact, after the tweet came out, we asked for a written memo from HHS because I couldn't implement guidance off of a tweet. The written memo didn't say the same as the video. There was a difference between healthy versus all.
You can't provide guidance off of a tweet.
I didn't think that was prudent. And then we did ask for the data to back it up, and we have not received the data to date.
To date, no evidence. Okay.
So what Senator Murray is highlighting here matters more than people realize. You know, pregnancy isn't just about nurturing one life, it's about protecting two. And that's why vaccines in pregnancy are critical. They protect both the mother and the baby. So let's break it down. The CDC recommends 3 key vaccines during pregnancy. A flu shot, because the flu can be far more dangerous for pregnant women and can lead to preterm labor. Tdap, which is tetanus, diphtheria, and pertussis. And that's given between 27 and 36 weeks of pregnancy. Why? Because those antibodies cross the placenta and they shield newborns from whooping cough in those most fragile first few months when they're just too young to get the shot themselves. And then RSV, that vaccine is a game changer. It helps to prevent severe respiratory infections in infants. And so here's the science. Babies don't come into the world with a fully built immune system, right? They borrow immunity from their moms. So in the womb, antibodies travel through the placenta, giving the baby their first shield. And after birth, breast milk continues that work. It's packed with antibodies that defend against infections while the baby's own immune system matures. And that's why maternal vaccines are so powerful. They guard the mom against serious illness and transfer protection to the baby at the exact time that they're most defenseless. So maternal Tdap, for example, lowers the risk of whooping cough in newborns by nearly 80% in those first 2 fragile months. And there's a video here from the Mayo Clinic that shows a kid with whooping cough. Let's show it.
Nothing I've ever heard before. He was coughing and doing the whoop. He'd vomit.
And he couldn't catch his breath. When they took Pedro to the doctor, the coughing had subsided, so they figured maybe it was just a cold or some other infection. But Chelsea knew there was something else wrong. So the next time Pedro had a coughing fit, her husband got it on video. A nurse practitioner saw it and diagnosed it right away.
And she saw it. She goes, that's pertussis.
Look at that poor child, right? As a mother,
Yeah, that's heartbreaking. Heartbreaking. Yeah.
heartbreaking. And then as a mother and a physician, I wouldn't wish whooping cough on anyone.
Nobody.
On anyone. I mean, that sound, the gasping, the struggle, it's unforgettable. And so that is exactly why the maternal Tdap vaccine matters. It lowers the risk of whooping cough in newborns by nearly 80%. So that kid's a little bit older, but whooping cough it's common in newborns if you don't get your vaccine. You guys, it's not just data, right? Those are babies that are breathing easier. These are parents finally able to sleep through the night. These are families that are spared tragedy. And it's just one more reminder that vaccines in pregnancy don't just protect the mother. They give babies the first protection they'll ever have.
Yeah, I mean, we know that research always shows that vaccines are safer, right? It's more effective, and we know it saves lives. And so here we are once again. When did politicians become so powerful when it came to health, making America healthy again? They've just done more than anything, pretty much sowing seeds of doubt. And that's been very consistent. And lately, that's not going to be safe for the push for women to have more babies, right? To have a pregnant woman that is in the crosshairs of all this misinformation, specifically about vaccines, is not going to be able to produce more healthy babies in America. So only about 47% of pregnant women will ever get the flu shot. That was last season. And now fewer than 60% of those are going to get the Tdap. So that means too many mothers and babies are going to be left very, very vulnerable. So which brings us to today, the childhood vaccine schedule. It's built on same principle, protect at the same time when the kids are the most vulnerable. We want people, specifically moms, but the babies from measles, polio, pertussis, things that we've been fighting with vaccines for years. Every shot is timed perfectly to close the window of risk so kids don't die. But the confusion is very, very dangerous from politicians. That a child missing a vaccine isn't just a personal decision of a parent. It's going to also affect all of us. It weakens our community immunity. And so that means more outbreaks, more hospitalizations, and even deaths from diseases that we've already dealt with in the past. So the choice is definitely clear. Science, not a spin on words. Protection, not politicians. From the wound to the classroom, we know vaccines do save lives. And every family deserves the truth, you guys, not fear masquerading as policy. Let's roll this next clip.
And I'm sharing the background just so people understand how serious even one case of measles is. The Infectious Disease Society of America says the median cost for a health department to respond to one case of measles is $32,000. So just multiply that by the 1,454 cases this year, $46,464,000 already to respond to measles, which is at a rate that we haven't seen in a number of years. A case costs a median of $3,200, but the price increases as you're trying to contact trace. The median price to contact trace is $223. So for Virginia, just to contact trace 1,000 people, $223,000 for one case.
That is just crazy. So the schedule isn't a suggestion, you guys. It's a lifeline to what we need in the United States right now. And when we talk about vaccines, it's not just names on charts. It's what happens when those diseases, all of these, come back. We had fought these, had been done with them. So let's make it very plain. Measles isn't just a rash. It's high fevers. It's pneumonia. It's swelling of the brain. And we're seeing all of this again. And so in 2023, the CDC reported multiple measles outbreaks across states, with most cases in who? Unvaccinated kids. So it's proof that when coverage drops, measles finds the gap and numbers go up. Polio, we almost forgot about polio until 2022, when a case of paralytic polio was detected in New York. And even today, the wastewater samples have still shown polio virus circulating in those communities. So this is not history, you guys. This is now. This is today. And pertussis, better known as whooping cough, just imagine seeing your child grasping for air, turning blue, a coughing fit. In 2023, the United States saw a resurgence of pertussis cases, with infants under 2 months old at the highest risk. And those babies are the ones that most often die, not because it's not incurable, but because we have misinformation now. So that's why maternal Tdap and early childhood series are non-negotiable. So politicians reduce this to parental choice. They're ignoring the reality here that these diseases don't care about politics. They don't care about people. They're ruthless, and they will prey on anyone that is unprotected. Dr. Brown, I can't believe we're living in these times.
And, just as a reminder that these vaccines, right, it's if you have the entire community, it's as if we're holding up a shield.
Mm-hmm.
But the less shields that are up, the more vulnerable everyone is, right? And so here's the truth. Children don't have a voice in these decisions. The parents do. But too often, these parents are facing really conflicting information. They're deciding without accurate information. They're bombarded by misinformation instead of science. So when children's voices are silenced in that way, it's their bodies that pay the price, and they're the ones that end up in the ICU or worse. Vaccines turned those nightmares into history, and now history is repeating itself, and it will have more of a resurgence if we're not vigilant. What do you think, Dr. Sloan?
I just pray that somehow all of this comes together and that we can get more organizations like the National Medical Association standing up this week, calling for RFK Jr.'s removal. The AAP, the American Medical Association, organizations that are finally speaking up and standing on word of what they know, science. So we here at AYA still believe in science. We know that spin is risky, and we're asking every parent to seek out the truth. Stay informed, stay vigilant, and remember, the truth is the most powerful tool we have right now. So thank you for watching. We are AYA, members of MeidasTouch Network, and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Thanks, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.